Thank you very much. I have been working in the public health space and the early learning space and the social service nonprofit space since I graduated from CASE. And this is what I love to do, and I hope to do it for a long, long time. So thank you for this opportunity to speak to everyone about the Centers for Families and Children and our journey to implement 2Gen and the whole family framework. It's something that I was tasked to do in 2019, even though I have been with the centers for a while, and we have been working on 2Gen since 2018. So, as the 2Gen strategy director, I am tasked with integrating in. Oh, thank you. Is this good? Closer? Oh, can you hear me? Okay, thank you. So, as the 2Gen strategy director, I'm tasked with integrating and increasing access to our three core services that you see here. And I also analyze and propose strategies to ensure that this implementation is completed through a 2Gen lens and it's anti-racist and also inclusive. So that's what I've been doing for a long time. And just to give you a little background on the centers, our journey to 2Gen began shortly after our affiliation with Circle Health that you see here. And Circle Health used to be called the Free Clinic of Greater Cleveland. So if you're from Cleveland, that's what it used to be called. And it provided primary care and dentistry and pharmacy services to the underserved citizens of Cleveland. And then we had the Centers for Families and Children, who had our core services of early learning and case management and also behavioral health. So when we came together in a nice little marriage, we had all the properties and all the things we needed for 2Gen. And it was fun, and we decided to implement the framework, and we're now known as the centers. We still go by the Centers for Families and Children, but just for brevity, we're the centers. And we have locations all along Cleveland and Cuyahoga County, Uptown, Midtown is where I work at the administration building, Gordon Square, Southwest, West, and East. So, like I said, these are our three core services. And after the merger, all of the services from both agencies were distilled down into these three programs. And I want to pause and say that the centers continues the legacy of the free clinic in providing care to everyone, regardless of your ability to pay. And so you can come to us with insurance or without insurance. We will still see you and treat you. And within these services, a lot were quick to transition to 2Gen. It was very easy. It's what we call those easy wins. We had a lot of the pieces that were together, but some weren't, and some still aren't. And that's okay because that comes with the knowledge that, this is a journey and it's part of the evolution. And it's something that I had to learn as a perfectionist and someone who's very impatient and wants to do everything now. Like, why is this so hard? But that knowledge comes from experience and knowing that you're dealing with people and families and systems that took a long time to put in place, so it's going to take that long or longer to change them around. So just to review our services, because I have to market and all that stuff. Hi out there to the centers. We have our integrated health. And the reason we call it integrated health because health is made of more than just going to your doctor once a year or seeing your doctor when you're sick. It's made of your wellness. It's made of your mental health. It's made of your eyes and your well-being. So we call all of our service integrated health. And our integrated health is available at all of our locations. And we have services from pregnancy to adulthood. And we also have a lot of family treatment options in which our 2Gen services are implemented. We have our early learning centers. All of our early learning centers are 5-star rated, which is the highest rated that you can get from the state of Ohio. Yay for us. And we provide flexible hours. We provide diapers and wipes and formula for babies. We provide breakfast, lunch, and snack for our children. Very healthy. We have a kitchen that caters to other centers and services as well as internally. And our children eat the same food, so they eat pretty good. And we use the gold standard of early learning curriculum, which is Head Start. And Head Start has always had a philosophy of 2-generational and multi-generational services. So that's what we use, and we had a very good foundation for that to start. As a matter of fact, our first 2Gen pilot was our CDA program, and that was a collaboration between our early learning program and our workforce program. And speaking of workforce, we have one of the oldest workforce programs in the city of Cleveland, El Barrio. And those services are also free. And once you become a client, you're pretty much a client for life at Workforce. You can return to us and work with a career coach, or you can return and work on another training track, and also help with the retention services. And right now, a lot of the new 2Gen initiatives are based out of the workforce space because they are a response to the barriers that our workforce families had told us that they have trouble getting over. So here is, and I'm going to preface this by saying the next two slides are drafts. So if they look busy and they looked a little weird, they're drafts, they're infographics that I've been working on with our design person. But the reason I'm showing you this is it's because it's part of our outcomes to educate our staff and our families about 2Gen. And a lot of people are visual learners, so we want to have an opportunity to show them what 2Gen looks like at the centers in context of the services we have. So you have our three core services here: family, health, and workforce. And you have the services that we have for our children, our parents, and also you see in the middle here, everyone's coming together. You see the grandparents here, you see the older children, the school age children, and the baby. And so we want to let people know that all of our services are build upon each other. And here's another example of this. They build upon each other and they're scaffolded. And so no matter where you come in the centers, you can get access to 2Gen. And hopefully these look a bit of familiar because they are based and inspired by the Aspen uh, infographic that we use. So we took that and said, how can we use that for the centers to help people understand? So we hope to make these dynamic and clickable on our website so you can go to each and learn about our programs and how our programs interact with each other. And when I first started, it appeared that we had all of the things that we needed. We were two very large agencies that came together. We were shortly after a collaboration with WESM that I was from. So we had a lot of programs and services that we offered, and we're very privileged to have that. And so implementing 2Gen seemed very easy, but like these drafts, they were not easy. And so we had a lot of learning and growing to do. And like I said, we've been at this since 2018. And so part of that implementation and part of our pilot projects, we're learning what we had to work with and what we had to change. And when I started, and I started really getting into 2Gen and Aspen and learning what they wanted to do in best practice, I quickly learned that a lot of our policies and our programs did not live up to these 2Gen guiding principles. So a few examples of these is that, like I said, we were a huge agency, lots of services, but our staff did not know what we did. If you worked in the early learning space, you didn't know that we had dentistry, or you didn't know that, there was a pharmacy that our parents could go to. And same in integrated health. There were a lot of integrated health staff that did not know we had an early learning program or a workforce program. And so if they didn't know, our families didn't know, and that was a problem. Also, with all these programs, we had different intake and referral systems, which was a nightmare for parents. If you did happen to go to another program, you had to fill out the same paperwork and answer the same questions over and over again, which is a barrier and it wastes time for families. So that was an issue. Also, in the same vein, we had different databases to collect and track information, and none of them talk to each other. They still don't talk to each other, but that's a problem because they measured the outcomes for the people that they serve. So either adults or children, and to the exclusion of our early learning program, never families. So we didn't know if you had children. We didn't know if you were pregnant unless you told us. We didn't know if you needed a job, needed a GED, or anything. If you came there for case manager of mental health, that's exactly what you received. We did not ask any questions or follow up on any of that. And so that was a problem. Another part was that our programs and services did not measure outcomes for everyone. So when we came together for meetings and everything, we didn't really speak the same language, which was a problem. So we needed to align all of our languages and all of the things that we measured at the same time. And finally, also, talking to our parents and our families and our clients and our caregivers that we saw. We did a lot of surveys, we had a lot of groups that met, but the consensus was when we started to do focus groups is what we were actually doing with that information. Was it useful? Was it being implemented in anything that we did? Because they couldn't see it. They could not see their reflection in what the services that we had. So that was a huge problem. And so from these learnings, we had our plan. And right about now, we're at the end of 2019, and everything's going great. So our plan was to scale and expand our 2-gen pilot programs. By that time, we had a few up and running, and we decided, what we were going to keep and what we were going to expand in our other systems. And so we said, okay, those are great. Let's do that. Also, identify champions throughout the agencies. You need people who understand 2Gen and want to do 2Gen to get everybody else on the train. You need rah-rah people. You need people to help staff get buy-in because 2Gen is something that either you assume you're already doing or you don't want to do because something else you have to do. So you have to get people that want to help you and want to, be your cheerleader for that. We also had to educate staff about 2Gen, what it was and how it related to the work that they did. Because again, you either think you're already doing 2Gen or you don't see how it's important to the work you do and how you help your families, especially if you're in different spaces other than working directly with families. If you're in workforce, you're there to help someone get a job. How am I helping their families? Am I serving the whole family now? What are we doing? So you had to educate them about that. And also focus on easy wins. There were programs that we already had that we could implement the 2Gen framework very quickly. And that's important because if you have those programs and you have those easy wins, you can immediately show the results and immediately show how it's important. So we had to find those. And finally, hire an expert. We needed help. I needed help because if we could do it, it would be done. So we needed to hire someone and find someone who had already did this, had experience in a large agency like we did to help us show the way. So we had the plan. It was great. The road looked great. We had the vision. Let's start. So we did. January 2020, we started. Yay. It was awesome. We were looking for a consultant, and then March 2020, the world changed. And it changed everything, as we all know. And everything that we had planned didn't go to the wayside, but we had to quickly pivot as an agency. We had to quickly pivot as a 2Gen department of me and see what we could do. So what we did is crisis mitigation, obviously. What do we need to help our families with? What do we need to help our staff with? How do we provide services in this new space that we have COVID, where everyone's at home, everyone is afraid. So what did we do? And what we did was we provided basic needs for people because it was difficult to get out. It was difficult to access services. So we need to supply tools and materials for staff and clients to continue services. And that means for our integrated health, for our early learning, for our teachers, for our workforce, how can you continue doing what you were doing before COVID and what could we do for you? And so that was difficult. We also had staffing changes. Our leadership and our staff looks very different than it did in 2019. And all that champion building and all that buy-in, we had to start over in some areas. So that was difficult, especially when you're going through a pandemic as an agency as large as we were. So that was difficult to get people back on board, like, hey, let's do 2Gen. People are dying with COVID. So it was difficult to do that. And we had to start that over. And also regression. When you're going through something like this, it's very easy to fall back into what you're comfortable doing, which was for the centers, silos, lack of communication, just working with the person that you're working with because that's what you're comfortable doing. So, I'm not advancing for some reason, but I will continue talking. But that is not to say that we threw 2Gen to the wayside. We did not. We were able to pivot and also provide services. And in this, we were able to see how 2Gen could be implemented because we had to. And it also fast tracked a lot of the projects that we were envisioning as part of 2Gen and providing services because we were able to do a lot of things that, we had to innovate for. And COVID allowed a lot of agencies to do that. What can we do quickly? What things are on the back burner? We were throwing everything against the wall. So, in those providing foundational basic needs for our clients, we had a centralized service that provided basic needs to everyone. And that means that we had to talk to each other. Who needs what and where do you get it from? And so we were able to communicate as an agency. Oh, you have this program. Oh, you're serving this person. So it opened up the lines of communication where we could not really find a way to do that before. We also did some barrier reduction. Barriers within the agency that we had created for ourselves over time, those artifacts of mergers and those artifacts of people who had been there before, if we can create them, we can destroy them. And that helped us streamline services and get services out to our families and our clients very quickly. And also building champions. Once people saw how 2Gen could work and how we were serving the whole family and how people were happy and we were getting things done, it was easy to convince people that 2Gen was the way to go. And also the no wrong door approach. We had talked about it, we envisioned it, but this time it really happened. So if you walked into integrated health and you needed food or you needed a job or you needed training, you were able to get that because now people knew where to go for it and where to send you. So that's what COVID did. So what's happening now? We're still in COVID-ish, and we're still working on that, but we are still on a mission to integrate our services and put 2Gen where it makes sense and where we have the most impact. So before we wanted to do 2Gen all the time in all of our areas. Well, it's not going to work like that all the time, and some programs aren't ready for that, either capacity-wise or it just doesn't work for their clients. So making sure that we're infusing 2Gen where it makes sense. So now our plan is keeping with the education of the staff across the board, and this means continuing to infuse the whole family language into what we do and making sure that that is consistent across the board and we're speaking the same thing. And this goes well with our new culture change initiative that we're doing and that diversity and inclusion that we're also doing. And 2Gen is now in our strategic plan. We rolled out our strategic plan at the same time we're doing all this, and 2Gen is in there. It's in there. Eric is very clear about where he wants the agency to go and what he wants to do. So that's important. That's the biggest champion we've got. Continue expanding and strengthening the programs that we have, not only the pilot programs that we're doing, but in this space of COVID and trying to provide services in a different way, we were able to develop 3 new programs for prenatal and pregnant people. And that is interesting and very cool because these 3 programs are in our 3 core services. So you have a program in workforce, you have a program in early learning, actually several programs in early learning for pregnant people, and a program in integrated health that we are doing now. And what's nice about that is the families can be enrolled in all 3 and benefit from all 3. And that did not exist before. And continue our universal intake and referral process. Like I said, we still do not have a centralized intake and database for all of our families, but that's okay because what we do have is staff that know who we are and where our services are and who to talk to. We can do that warm handoff. We can send that email. We can use Teams to talk to people now because we had to do it and now we can do it. And that was something that we developed during COVID. So if you need to call someone at East and you're at Uptown, you can do that because the client is sitting right there. And so we're developing the universal intake in a way that gets around the barriers that we have with our multi database systems, and we're going to continue to develop that. And also family centered mental health. A lot of mental health needs developed during COVID for families and children and parents. So we are on a fast track to develop mental health services. And what's included in that is a service, a program through our workforce development program that allows families and parents to enter at the entry level in mental health and similar to our CDA program, work with our integrated health providers to do this. And what it does is it increases the capacity of our mental health professionals and also increases the capacity of mental health professionals who are people of color and speak a different language. So that's going to be very cool when it rolls out. And hopefully next year I'll be talking about that program. And also developing a classroom for children with behavioral health challenges. And this classroom is neat because it's a separate classroom from our early learning classroom. These children are in there for a short time, but it's staffed by specialized teachers that teach the teachers within our agency. And also parents have access to that. So they're learning the tools that they need to help their children succeed at home. And once the children get those services, they're integrated back into our typical classrooms. And those services are available to them year round. And also family voice. We are using our lessons from COVID in Zoom and hybrid meetings to make sure that we solicit family voice and be intentional about placing it into our policies that we're doing. So we have a lot of groups that we're doing, focus groups. We're bringing up our parent, our not a parent group, our group for our integrated health group that is client based, so they can give us feedback on the services they receive. And finally, that's what we've been doing. It's been a journey for us, but we have a committed leadership through Eric and all of our executive leadership. You have me that's trying to, take us through this very gently. And I'm passionate about everything that we're doing. But I am very hopeful that next year we will be in a position to report out to you everything that we're doing with our outcomes.